We're going to move on because we decided to take the air pollution debate outside Delhi to focus on Mumbai, where air quality has been plummeting. What are the experts saying? We'll be joined by a few in just a few moments, but we've got Hiren Jetwa, a very special guest. He's one of the finest NASA scientists looking at, among other things, forest fires and agricultural fires, I should say, in parts of India. We'll also be sharing with you fairly exclusive data on the farm fire situation in Punjab, with a look at satellite imagery of today's data situation and also look at this day a couple of years back. So before we actually go across to Hiren Jetwa, who's a senior research scientist in the Morgan State University and at the NASA Goddard Space Flight Center, let me just bring across a couple of those images. And what we can actually show you are images over the last couple of years. Let's just have those images, those pictures out with us. So this is 2019 and we're focusing on Punjab, and the dots that you see on your screen are of farm fires. Now it changes every year. Let's go to 2020 and then keep scrolling from one image to the other. Now these are just visual representations. If you look at these themselves, they do not say much other than the fact that this has been a problem virtually every year. 2021 was much lower. And let's take a look at 2022 and then bring you an image of just a couple of hours back of the 25th of October 2023. And this is the image that you have on your screen. All those areas which have been marked in red over there are areas where there have been significant farm fires in the last little while. But I think to actually understand some of the data, we need to look at the trends of the month of October between the 1st of October and the 25th of October. So let's just have that data out. And that data is actually quite interesting because, as you can see, between 2012 and now, with the exception of 2016, when farm fires really raged over Punjab, there's been a broad downward trend. There have been some outliers, for example, 2020. But if you look at 2023, that number indicates that stubble burning in Punjab has been at its lowest since 2012. Hiren, is there any explanation of that data? Are things getting better? Is what I think people in India would want to know.
Yeah, hi Vishnu, can you hear me?
Yes, I can. Go ahead.
Oh, okay, great. Yeah, so I was surprised to see that the fires so far in the Punjab and Haryana region has been the lowest since 2012, 2016. We never saw such low level of fires in last many years. And that point me to think that there could be two possible reasons. The first reason is it could be that the burning season, the harvesting and followed by the burning season has been delayed for some reason. And I was reading some reports just today morning, and it seems that the rainfall was excess in Punjab and Haryana this July, August. And that destroyed some portion of the rice and other crops. And also there were some rain spells in October, and that delayed the harvesting season in some parts of both states. So I'm a bit afraid that the season has been delayed and we haven't seen yet the peak fires in coming 2 weeks, October last week and November first week. That's where normally the burning activities peak. So I'm keeping my fingers crossed, but I'm a bit afraid that this year the harvesting and the dynamics of burning is quite different from the other years. I think it's mostly forced by the excessive rain in both states, both in July, August, where we have the peak monsoon season. Some parts are some portion of the crops has been destroyed, and later they replanted the rice and other crops in July and August, which is too late actually. So which we are not seeing yet, and that's why I think we are seeing the lowest number of fires so far, because I think farmers are still waiting to harvest the lately grown crops.
So we could actually see significant forest fires in the days ahead. In terms of air pollution levels, Hiren, is there any direct correlation that you are seeing? Because the levels, for example, in Delhi are still fairly high. They were yesterday, and yet the forest fire numbers are low. So what explains that?
Well, it was low, but it was. I looked at the PM 2.5 data from the U.S. Embassy site in Delhi, and it was an episodic transport of the smoke from the nearby fires in Haryana. So fires are not still not zero; it's still at lower level, but it's just a one puff of the smoke transport, the pollution transport over the Delhi region, and then it went back to, I would say, not normal level, but to a lower level. Uh, but there are also some fires in UP, in the northern part of the UP, and also in the eastern part of Delhi, which might be also contributing to the pollution level up to some level in New Delhi.
And Hiren,
And
I
and,
think an
and that,
important point is that every year, because agricultural practices are same on both sides of the border, forest
yes,
fires in India affect Pakistan and vice versa. So the entire Indo-Gangetic plain is in fact impacted as a result of forest fires, not just in India but Pakistan as well, East Pakistan.
that's true. You have shown that map, right,
Yeah.
of satellite data that we got
In
today
fact,
morning.
let's have that last frame out of today's data, but go ahead here and continue with your
So
point.
that's why, yeah, you could see that those fire hotspots are on the both sides of the border, and depending on the wind direction that on a particular day, that will determine that in which direction the smoke outflow will take place.
Yeah.
But normally speaking, seasonally the winds are northwesterly, so winds are flowing from northwest to the southeast. So whatever we burn in Punjab and
Yeah.
Haryana, Delhi is the next stop. It's in the vicinity of this burning region, and the whole this the what we call the river of smoke.
It
It
just
flows
continues.
from the Punjab,
It
Haryana
does.
all the way to Bay of Bengal.
No, it does, and that's a huge concern. Hiren, thanks very much for explaining
Thanks.
some of that data and the early trends. And I think that the takeaway for me from this
Right.
discussion is that these are early trends, and that it's something that
These are
we
very
will,
early trends, and
yeah,
the season, the burning season, I think
has
is
been
delayed
delayed
this
and
year.
may not have started. So we need to be careful. Let us
Yes,
hope it stays low, but
it
chances are
stays
it
low.
will not. But Hiren, thanks very much for being with us. Thanks very much
Thanks,
indeed.
Vishnu. Thank you.
While the focus every year is on pollution in the national capital region, the situation in Mumbai is getting to be alarming. Consider this. Now, the 4-year high pollution levels that we've seen in October this year are very, very significant. It points to an increase in pollution levels at multiple levels. What exactly is the cause of this? We'll be looking at that. The air quality index in Mumbai over 200 at several places. Between January 1st to February 17th, early this year, 12 days of air quality index in Mumbai was higher than that of Delhi, which has traditionally been the most polluted. In the winter of 2022 last year, poor or very poor quality was recorded on 66 of 92 days. The reason we are focusing on Mumbai is it is absolutely critical to understand that the entire issue of air pollution and air quality it goes well beyond the national capital region, and it certainly impacts Mumbai as well. What is the toxicity that we are talking about? Where does it come from? Construction, dust, unclean fuel burning in restaurants, eateries, for example, the open burning of solid waste, and industrial pollution are some of these factors. Now, the Mumbai municipality has actually stepped in, and we see a lot of solutions now in Mumbai, which we've seen in Delhi as well, but the point is, are these really solutions? The installation of sprinkler systems in 15 days, the installation of anti-smog machines in 30 days, 35-foot iron enclosures on construction sites is mandatory. The installation of air quality measuring devices are important as well. So that's what Mumbai has done. What has Delhi done thus far this year? Remember, air pollution is plummeting in Delhi as well. Apart from 13 hotspots, 8 new areas have been identified with an air quality index of more than 300. Special teams have been deployed to find the causes of this. District commissioners are on a check pollution activity, a check pollution drive in the city. Dust suppressants are being added to water being sprayed. An anti-dust campaign is being intensified, and there are instructions to remove traffic congestion at 91 points. The frequency of the non-polluting metro is being increased, and the Delhi Transport Corporation, which runs buses, has been asked to increase bus frequency and hire private buses as a means of getting the number of private vehicles off the roads. Remember, DTC's fleet runs on CNG, so it is, it doesn't generate pollution per se. Action against the violation of diesel generator rules is what Delhi has pushed for as well. So that gives you an idea of what Delhi is doing, what Mumbai is doing. We're joined now by Dr. Jalil Parkar, the senior pulmonary physician at Leelavati Hospital in Mumbai, Ronak Sutaria, founder of Respira Living Sciences Private Limited, Abhishek Kar, the senior program lead at the Council on Energy, Environment and Water, and Palash Mukherjee, the lead air quality and health at NRDC. I'd like to thank you all very much for being with us. Dr. Parkar, just from a health standpoint, are you seeing a significant rise in cases of patients that come to, for example, consult you or to your hospital in the last couple of days in Mumbai?
Yes, I think the rise in respiratory cases have been since the last maybe a month or more than a month or so.
And I know you may not have absolute numbers, but would you give us an approximate percentage rise that you are seeing in the last couple of, let's say in the last month or so, compared to what it was earlier?
Me being a respiratory physician, all the patients who come usually come with cough, cold, fever, body ache, etc. and with, of course, bronchospasm. So I would say that the number of patients that come to us, besides the other illnesses, is nearly 60-70%, and not less.
There's a 60-70% increase in patients, in these particular ailments that you're talking about. All
yes,
right.
Absolutely.
All right. And Dr. Parkar, just since you've been a physician for so many decades, in Mumbai, would you be able to share your personal experience on how this is going up, or have we traditionally seen these numbers, but it's just not been reported?
To be very honest with you, I think Mumbai was much more cleaner from the pollution point of view because we are on the seaside. But over the years, I think the pollution is increasing, and there are a lot of factors which are contributing to it. First of all, there is remarkable construction that is going on, number one. Number two, the weather is changing dramatically time and again within a couple of days. Number three is the cleanliness that we are supposed to maintain in a city like Mumbai. Frankly speaking, it's not so, because you have the municipal authorities and employees who come and clean the road, and they collect all the dust, etc. at one corner, and then they put it in some garbage can or so. But then it's the wind that blows all over across. And then if you see near the Jhoppadpattis, most of this garbage is burnt, which has plastics, it has bottles, it has bags, it has food, everything. I think these are all toxic materials which are affecting. And lastly, but not the least, it's most important is that many of, because of religious beliefs or whatever, many of us are feeding not only the pigeons but the crows also. So the pigeon menace is a huge menace, and especially it is all over wherever the pigeons are fed. And those respiratory diseases are quite bad. In fact, they bring in fibrosis of the lung over a period of time.
No, that's so important, and it's something we just don't talk about. We talk about fumes coming out of industrial stacks or from car emissions, but what you're talking about is a serious biological hazard. And it is a fact, not just in Mumbai, but across, and it is very much, pollution driven from the air. I want to go across to Abhishek Kar as well. Abhishek, why has the sea breeze, as it were, which is most of us felt been key in removing air pollution from Mumbai, why is it no longer as effective? Is it because of increased construction activity? Are there weather conditions which are changing? What is your thought on this?
Right, and I think there is rarely a chance to give a simple answer to this question, because in natural phenomena, when there is a change in it, there are multiple factors, both anthropogenic human factors as well as climatic larger factors which come into play. But the fact is that the air quality in a city will depend on both things. One, the meteorological conditions, which are not in favor of Mumbai at this point, and human activities. Now, thing that is under your control are the human activities. You really can't do much about the meteorological factors, because even if you think about the climate change linkages, it is really a long-term thing. You really cannot do anything right now, and that is going to solve the problem. So given that, I think the focus should be in terms of better enforcement of the guidelines. I think the challenge has been that in terms of policy, there is significantly in the recent days lot of new policies come into being, but the challenge is how well are they being enforced. So I think we have to come back to the very basics of governance again. If something is said, okay, you should do A, B, and C, are they actually being done on the ground? Does the BMC have sufficient resources, both in terms of personal vehicles, to see that whether construction sites are following what has been laid down? Are the construction companies themselves initiating instructions to their own staff and members and trying to find out, are the rules that a government has asked them to follow, are they being followed? I think the challenge is that we only wake up to this challenge of air pollution when things are at severe
when we can't breathe, right?
worse.
No, I get your point. Palash Mukherjee, come in over here in Mumbai, in Delhi and parts of North India. This time of the year, we see stubble burning, and that has a direct impact. It's been statistically proven on certain weeks of the year. In Mumbai, do we have any statistical evidence of what exactly is causing the air pollution this time? Because otherwise it's vague, industrial sites, construction activity, more car emissions. I mean, that could be true of any part of the world.
I think it's very critical to know that we know what the sources of pollution are across our cities. They are more or less common. They could vary in what each individual source may be contributing. But I think what the experts before me have said, and what I also continue to say, is that these sources need to be worked on through the year. Like you said, in vehicles, construction, industry, these are all contributing to varying degrees. In Mumbai, it may be a higher element of construction. Also, there might be element of the inversion effect and the pollution being trapped because of the higher urban density. But the solutions are to build long-term effective frameworks for this. And this means deployment of technology, but also personnel across the year. Like, for instance, what has happened in the last 10 days or so with the construction rules being implemented suddenly. These rules have existed for a while, but they're being implemented now. Now, what remains to be seen is if these are being implemented through the year in the coming year. What I'm saying is that there's not much that can be done at this stage to bring an immediate relief. I'd also highlight very critically what you pointed out to the doctor panelist in the beginning of the session, is that we don't have the statistics on this, on what the health impacts are. And that also is a very critical long-term intervention, monitoring and evaluation of what the health impacts are of this, because they're not uniform. They affect outdoor workers more. They affect certain individuals in certain zones more. They affect women and children more. So it's important to highlight those so that the urgency of action is brought to the fore.
I think that's an important point. Before I go across to Ronak Sutaria, I think it is important to just remind our viewers, and I did this earlier on as well, on why exactly we are discussing this. We are discussing this because there's a very clear link between air pollution and fatalities. If we had this discussion 10 years ago, we didn't have this data. There is overwhelming data now. The bad air that we breathe is what is killing us now. So let's just have graphic 7 with us right now. I want to go through a couple of the key surveys which actually identify this. First up, let's take a look at what Lancet has said. A Lancet study has said that 1.6 million premature deaths occurred due to air pollution in 2019, with India topping in deaths because of air pollution. Globally, China was second. In 2019, pollution deaths accounted for nearly 18% of all deaths in India. Now, this is Lancet. It is extremely credible. And that number of 18% is whopping. If you were to put that into an actual number, it's lakhs of people killed every year as a result of air pollution. Greenpeace says over 120,000 people died in air pollution because of air pollution in India in 2020. Significantly, it caused economic damages of 2 lakh crores in India. Imagine if 2 lakh crores was actually added to our annual GDP, or it was added as a statistic which influences our economic growth. We are actually losing this if you look at the loss of life and productivity as a result being impacted as a result of poor air. Greenpeace and IQ Air in 2021 have said 54,000 premature deaths in Delhi in 2020 because of air pollution. But there are extremely other very, very credible sources. The University of Chicago says that in a study that our lives in Delhi are going down by almost 10 years on the basis of the air that we are breathing. If the air was cleaner, we would live longer. A Harvard study of 2021 says 1/3 of deaths in India every year are linked to air pollution. The WHO report says air pollution is causing 7 million premature deaths a year globally. Ronak Sutaria, some of the measures now announced in Mumbai, sprinklers, greater monitoring of construction sites. We've seen this in Delhi, and a lot of people, dust suppressants, a lot of people would say that this doesn't really do anything. That, it shows that the government or the municipality is trying, but you don't control pollution with a water sprinkler in the air, which is what this is.
Yeah, Vishnu, absolutely. I think we've been looking at a couple of different things. The NCAP, which was rolled out for Mumbai, the bulk of that program implementation was used for the EV bus systems, and these knee-jerk reactions which are happening currently in the winter months in October is not coinciding or is in sync with what the NCAP related spending had happened. So the entire focus of the state government in using and the municipal corporation in using the clean air budget had gone into the electrification of the public transit system. Having said that, we've also been very closely looking at the winter data for Mumbai, and there are two things which, particularly have stood out. One is a slightly good news. We haven't had any news which have had even a tinge of being positive, but we found that the NO2 pollutants, NO2 and benzene pollutants actually have gone down in Mumbai over the last 4 weeks, as compared to the same 4 weeks in the prior year. And NO2 and benzene are direct emissions from vehicular pollutions. So there is something which is saying that probably vehicular pollution may be on the bend and it might be reducing. Having said that, the particulate matter pollution has doubled. It has increased by 100% in the same 4 weeks when we looked at October 22 compared to October 23. Particulate matter is the more harmful pollutant. The sources of particulate are slightly different from the NO2 and the VOC pollutants. But having said that, something seems to be working, but a few things are significantly not working. So the bottom line in this is that Mumbai, the numbers that you read out from Lancet, that you read out from Chicago studies, the exposure rates in Mumbai are far, far higher. So Lancet numbers which came out in 2019 and 2021, if they were to be evaluated for Mumbai in 2023, the situation would be even more dire. But having said that, I think what we need to evaluate more closely is that some things, from the vehicular pollution side, from some kind of combustions are working, but the dust related and the particulate matter pollution situation has doubled for Mumbai, which is a huge cause of concern. Yeah, so we need to bring the science into understanding, what's going right, what's going wrong, and we need to encourage what's going right. So I think there are these dimensions to it.
No, I take all of those points. Dr. Parker, one final question to you. Are you in a position now, on the basis of new science, new medical learnings, able to attribute a death to air pollution? Because typically, a person dies because of a heart attack or of the failure of certain organs, etc., any number of causes. But, no one says that it was caused by air pollution. The cause of death is always something different. But there is all this data now in front of us. Therefore, as a doctor, are you able to sufficiently have enough evidence to say that X patient has passed away because of air pollution?
Of course, I mean, with the advance in our medical equipment, CT scans, etc., pulmonary function tests, etc., your ventilators, we are able to assess and we are able to say that yes, it is because of, say, interstitial pulmonary fibrosis, because of pollution, or because of the other reasons that are there. Now, what we were talking about was one of the causes which I missed in my previous talk that I gave in a couple of minutes back was wherever this construction is going on in every neighborhood, there is a sort of a factory where they produce, they crush stones and they produce a sort of gravel that is used into construction. Now, nobody is having a look at that. And what are we talking about? I mean, I don't want to get into the statistical jargon. If you see all these instruments that they are talking about, which are going to be used in South Mumbai, what is it going to do? Is it going to cover a kilometer or 2 kilometers? I don't think even that. So what are we talking about? We have to get down to see to it that the pollutants are decreased all over in the city of Mumbai. You have dumping grounds. Previously it was Devnar. Now you have Marvel. You are burning things over there which are all toxic. So let's not get into the political jargon or get into the statistical jargon. Let us treat the patient and let us see to it that we give a healthy living to each and every human being rather than talking about these issues, getting this machine, that machine. The cleanliness has to be there. The basic cleanliness, if it is not there, how are you going to improvise? If there is no control over construction or the sites of the construction where the norms restricting to pollution are very stringent, only then you can bring an improvement in the quality of life of your human being.
And that's what it's all about. Look, gentlemen, I'd like to thank you very much for joining us. It's important that we focus as much on Mumbai and other parts of the country, not just the national capital, which has become synonymous with air pollution. It's not just the national capital. That's what we'll be focusing on throughout the next couple of months on NDTV.